Good afternoon to all of you. I am Dr. Asha Shetty, Professor cum Principal, College of Nursing, AIIMS, Bhubaneswar. I also hold the additional responsibility of Chief Nursing Officer of OT and ICU at AIIMS, Bhubaneswar. First and foremost, let me extend a heartfelt thanks to Dr. Sanjukta Sahu, Director of Nursing of Odisha, for such a wonderful work with State Health Department and NHM Odisha. I would also like to thank the Registrar, Mrs. Lakshmi Mani Tudu, and all other nursing consultants for giving us this opportunity to co-host this webinar series exclusively for the nursing officers who are working in clinical area. I, along with my panelists with me here, convey the greetings of our Director, Dr. Geetanjali Padmanabhan, our Dean, and all other administrators from AIIMS Bhubaneswar. Today, we are here to discuss on the topic that is care of the patient with COVID-19, and we present to you how we receive the patient in emergency ward, how we take care of the patient in the ward, what is the care that is needed in intensive care unit, how to set the ventilator, and how to manage the nursing workforce for a care of the patient in COVID-19. So, to begin with, I once again extend a warm welcome to all of you as I begin the first session on best clinical nursing practices in COVID-19 pandemic situation. The objective of this session is, at the end of this session, the participants will be able to understand the best clinical nursing practices in COVID-19 pandemic situation. Knowledge about transmission of the COVID-19 virus is accumulating every day. We are in the most unbelievable times of COVID-19, where the healthcare world has been turned upside down. COVID-19 is making extraordinary demands on nurses and the other healthcare workers as they work tirelessly and at great personal risk to deal with this crisis. Their resilience show as they toil with limited resources or with totally non-existent resources, pulling extended shifts and putting their self-care on the back burner. I salute all those nurses who have especially sacrificed in all possible ways in spite of the social stigma that they have come across. As frontline healthcare workers, nurses face unprecedented challenges to face COVID-19, and it is a time of great stress and uncertainty, and nurses are rising to challenge. It is imperative that we remain updated with everyday changing advisory in combating such a highly contagious disease. SARS-CoV-2 is highly contagious and found to be transmitted through respiratory droplets and contact routes. Therefore, healthcare workers must strictly follow appropriate infection prevention and control precautions. IPC is critical and integral part of clinical practice. The standard essential infection prevention and control precautions recommended to be followed by healthcare workers while caring for patients infected with COVID-19 include adapting to a practice of frequent hand hygiene with alcohol-based hand sanitizer. It's essential to deploy minimum number of healthcare workers in an isolation area and bundling of nursing interventions to reduce further exposure to other healthcare workers, and also essential to follow strict social distancing norms. Use of triple layer mask is part of comprehensive package of prevention and control measure that can limit the spread of certain respiratory viral illnesses including COVID-19. It is also essential to follow and educate others on healthy coughing and sneezing techniques. Let's discuss some more aspect about the use of mask. The universal masking in healthcare facility means it is the requirement to wear a surgical mask by all healthcare workers and anyone entering the facility no matter what activities are undertaken. The targeted continuous medical mask use means here as the practice of wearing surgical mask by all healthcare workers and caregivers working in clinical areas during all routine activities throughout the entire shift. We need to remember there should not be sharing of used masks between the health workers, and we need to also know how to dispose the used mask. Rational use of personal protective equipment is another best clinical nursing practice. Ultimate aim here is to have optimum utilization of personal protective equipment, for which we need to use the personal protective equipment appropriately, use it judiciously, and when times of need. We may minimize the use, and also we need to coordinate the chain of supply. I request you to refer to the Ministry of Health and Family Welfare guidelines for further reference to use what type of personal protective equipment to be used in case of minimal risk area, moderate risk area, and also high risk area, and thus leading to optimal use of personal protective equipment. For further instruction on how to don and doff the personal protective equipment, you will find beautiful videos in YouTube. As you find the link here, in YouTube you can log in and enter College of Nursing, AIIMS Bhubaneswar for donning and doffing videos. As I mentioned to you, the use of personal protective equipment is very important while caring for a patient with COVID-19. It is also essential that we dispose the used waste appropriately. Especially in donning and doffing area, we need to have the further surveillance and monitoring. This doffing area is a very contagious area and it's a main source of infection. Hence, we need to adhere to biomedical waste disposal guidelines for proper waste disposal. Care of the patient, unit and surrounding area is another important aspect that we have to keep in mind, especially the high touch area to be given more importance and to be cleaned every second hourly with 1% sodium hypochlorite solution. Another very important nursing practice which requires utmost care is documentation. Unlike the other infectious diseases, the use of personal protective equipment in COVID-19 exposes us great challenges in maintaining appropriate documentation for patient care. Hence, it is recommended to have digital recording, which will also help in containing the spread of illness through fomites and transfer of records. Digital recording will also reduce the inconveniences to hold the pen to record any matters related to procedures. The practices, who and where and what aspects of the care that is provided to the patient as per the policy of the institution. Because nursing documentation is the only proof for the care that is given to the patient by the nurses. So whenever convenient, it can also be recommended for maintaining the duplicate records in hard copy along with the digital record maintained in the unit. As nurses, we have been working in good teamwork and that needs effective coordination. As we see, it is good to have shift in charge during each shift for every shift for facilitating easy communication with the caring team and the person outside who is wearing personal protective equipment which restricts the movement to other areas. The in-charge will maintain good communication for supply of materials with the unit doctor as well as when needed for duplicate record management. Let's move on to another best clinical nursing practice, which is evidence-based nursing practice. The recent report on International Council of Nurses indicates that more than 600 nurses have died for COVID-19 and nearly 230,000 healthcare workers have been tested positive with infection. This leads us for various doubts. like why it happens in spite of using personal protective equipment, following all the infection prevention and control precautions? What is the level of knowledge that is prevailing among the healthcare personnel about the virus? Is there a fear among the healthcare workers to work in COVID areas? So such many doubts those arise in our minds. So it's very essential that we undertake small research projects which can help us for best evidence-based practices. As we move on to the last slide, I would like to say that we need to work effectively with a teamwork, which can strengthen us for relentless work and support for each other in times of need, which can make us strong in our day-to-day daily routines. With this, I conclude my session on best clinical nursing practices for caring a patient with COVID-19, and now we move on to the next session. I call upon Mr. Benny to discuss on the topic how to receive a patient in emergency ward and how to shift the patient to the ward. Thank you.